had a question earlier that you mentioned to me outside. You want to ask it here?
Sure, absolutely. First off, thank you so much for being here, Secretary Kennedy, and thanks for coming to Oklahoma. We had a great time. Oklahomans love you, and we also did the SNAP benefit waiver, and so we're excited about making Oklahoma healthy again. My question: you mentioned that there's about a $1 trillion cost in chronic disease. Do you have any stats when you get people healthy again, what it does to the economy? We had an economic update earlier about GDP rising at 1% this year in 25. But if you get them healthy again, not only the cost, but also what does that do with the workforce and getting people back healthy to engage in our workforce?
Well, you know, I went on a long hike with Dr. Oz this morning, and he's going to be talking to you tomorrow. But he showed me a data point of a study that they just finished that showed that if you could get every American to do a 15-minute walk a day, it would save the country $150 billion. The cost saving, you know, I said before, when my uncle was president, we spent zero on chronic disease. There were no treatments for it. The first pill that you took every day was the birth control pill. There weren't any pills like that before that. There weren't treatments, and you know, the cause. We are spending this money, and I'll give you an example. During COVID, we had 16% of the COVID deaths in our country. We only have 4.2% of the world's population. And if you ask CDC, why did so many Americans die? Why did Americans die at a rate of 3,000 per million population? When in Haiti, they were dying at 14 per million population. Nigeria, they were dying at 14 per million population. Across Africa, it was 320 per million population, so 1/10 of our death rate from COVID. Why is that? And CDC will say that's because Americans have such high levels of chronic disease. We have the highest chronic disease burden on earth. The average American who died from COVID had 3.8 chronic diseases. So what was killing them? Was it COVID or was it the chronic disease? They were hanging by their fingernails at the edge of the cliff already. And COVID came over and stamped on their fingers. But what's really making it, the real costs are not from COVID. The real cost and the cost we have. If a kid has diabetes, if a kid, COVID was killing. The average age of death from COVID was 84 years old. If you have a kid with autism, you have 75 years of life in front of them. And the cost of that, if we can stop the autism epidemic or dramatically reduce it, which I believe we're going to do in my 4 years, we can, you know, the cost savings to our country will be astronomical. And diabetes is the same. We start getting kids to stop drinking soda, stop eating junk food, and start eating real food again, we're going to see immediate cost savings, because people with autism, there's no cure. Diabetes, there's a cure. You can cure diabetes with diet. And you know, one of the things that we're asking governors to do, if you have a medical school in your state, we're asking you to pass a law, and these laws have passed in about 6 states so far, and they're bipartisan, Democrats and Republicans. There's no such thing as Democrat children or Republican children. They don't face strong headwinds. It's an easy law to pass to require medical schools in your state to give a mandatory nutrition class. Doctors are not taught about nutrition. So when you come into the doctor's office, he doesn't know any more than you do about nutrition. And you know, he ought to be, not the first thing he does should not be to give a 9-year-old kid a GLP drug. Yeah, in the long run, you know, if there's no other choice, let's do that. But let's try diet and exercise first, and let's have a medical community that understands those things, and that's their first reaction rather than giving you a drug. And most of the medical schools do not have mandatory nutrition classes, and we need to do that. We're incentivizing to do that at HHS. We're getting them to develop really good curricula on that. But you know, one of the things I said to the governors yesterday is what you do is so critical to what I'm doing. We have 40% of the food industry that has now pledged to remove all dyes, all 9 petroleum-based synthetic dyes. They come to us and ask us and say, we want to do this, we want your support, you know, help us do this. They're coming to me not because they're scared of me. They're coming because they're scared of the governors. Because they don't want a patchwork of different regulations all across the country when they got a national product. When you push this legislation in your states, it enables me, it gives me leverage to these industries to change their behavior and to change the ingredients that they're giving us.